Let's go. So I'm Bruce Campana. I'm an emergency physician. I'm probably the worst emergency physician on Vancouver Island. And I may actually be the worst in the province of BC. And I wanted to thank you for asking me here tonight so that I could share some of my techniques. So when I say I'm the worst physician, it's by the numbers. So I admit more patients, I do more CT scans, and I take longer with patients than I'm supposed to. And the reason for that is that I haven't embraced technology. So what I decided to do is embrace technology and do digital medicine. So what I'd like to do tonight is take 3 cases, pneumonia and multiple trauma and a cardiac arrest, and share them with you. But I'm not going to tell you what I did. I'm going to tell you what I should have done if I had been using digital medicine. So let's start with the first one, pneumonia. A woman walks into an emergency department with a cough and a fever. The triage nurse orders blood work and a chest x-ray. A computer can interpret them, diagnoses her with pneumonia, a prescription is issued, and she's out on the street in 30 minutes. Effective and efficient care. Our next patient is a multiple trauma, a young woman hit by a truck. She comes into emergency, she gets a stat CT scan. The scan is sent by telemedicine to a neurosurgeon who's on call at home. The neurosurgeon is able to read the scan, phones emergency, and says, this is a lethal injury. This woman will not survive. Let's emergency actually move the patient out into a separate room where she can complete the process of dying. It also lets emergency clean out the trauma room and get ready for another patient. It's effective, it is efficient. Our final case is a cardiac arrest. Cardiac arrest patient will come into emergency, they get hooked up to an automatic external defibrillator. A technician can do it. The defibrillator will interpret the rhythm and give a shock as needed. Technician can follow a protocol or an algorithm and give drugs as needed. The patient dies, but the patient received effective and efficient care. Technology saves time and money. The pneumonia case didn't even need to see a doctor. The multiple trauma the cost of a neurosurgeon was saved by telemedicine. And the cardiac arrest didn't need a physician because a computer could read the rhythm. Ladies and gentlemen, I think we can see that technology is the future. And I need to embrace it. The future, ladies and gentlemen, I think, if we embrace technology, the future is bright. Thank you very much. Except for maybe one thing. Maybe technology isn't everything. Maybe there's more to these stories. Maybe in our rush to be efficient, we're missing out on some of the important stuff about these patients. Do you mind if I just take a look at some of them again? Our lady with pneumonia had just watched her mother die of lung cancer. And that's what she was scared about. And what she needed, besides antibiotics, was somebody to sit down with her and say, you know what, you don't have lung cancer now, but if you don't stop smoking, in 5 to 10 years, you just might. Our multiple trauma was a young mother out with her husband, the first date night after the birth of their second daughter, and they had an argument. And she was so angry, she stepped off the curb and she didn't see the truck coming. And she was brought to emergency, and you know what? Even all the technology in the world wouldn't have made a difference. She would have died. But there was one patient there that we missed, and that was her husband. And he blamed himself for the argument. He blamed himself for her death. He blamed himself for the fact that their 2 daughters would never see their mother again. And somebody needed to take time from being efficient and sit down with him and tell him, it's not your fault. And what about the cardiac arrest? Let's take a look at a busy emergency department where an emergency nurse goes up to an emergency physician that she trusts and says, there's a cardiac arrest coming in. And that's routine. The emergency doc says, okay, well, let's get the resuscitation room ready and let me know when they're here. And he keeps on walking. And the nurse runs after him and puts her arm on his shoulder and says, the patient is a 7-year-old girl. And that's not routine. And the emergency doc says, oh, okay, well, let's get the resuscitation room ready, but let's call pediatrics and have them down there with us. And he starts to walk away again. And the emergency nurse runs after him and grabs his arm again and says, "The patient is my daughter." And everything changes. She wanted the person she trusted the most to look after the person she loved the most. She didn't want a computer, an algorithm, a protocol. She wanted to know that if her daughter died, she had done everything that she could do for her daughter. I guess I should embrace technology. You know what? I would be more efficient. I would see more patients. I would make a lot more money. And my numbers would be better, and administration would be a lot happier with me. I mean, isn't that kind of a win-win situation that everybody would be happy with? You know, let's be real here. Technology saves thousands of lives and millions of dollars every year. And I'm 60, and I'm not getting faster, and I'm not getting younger. And the fact is that in order to do my job that I love and do it well, it takes two things. It takes time and compassion. And it turns out that compassion isn't digital. Some patients need time more than tech. And that's a concept we call patient-centered care. And what I worry about, and my hope for the future, is that we don't toss aside patient-centered care in our rush to be efficient. I am the worst physician, Vancouver Island, and maybe in the province. I admit too many patients, I order too many CT scans, and I take too much time. And my other hope for the future is that next year, I'll be even worse.